Blood Purification Therapy, Lesson 6, Body Fluid Management. This unit covers the basics of blood purification therapy. The goal for this lesson is to understand what dry weight is, and to learn about indicators of dry weight management. This is the content of this lesson. According to the definition by the Japanese Society for Dialysis Therapy, dry weight is defined as a body weight with an appropriate volume of fluid, which prevents intradialytic hypotension, and minimizes the impact on the cardiovascular system for long-term dialysis. A wide range of indicators are taken into consideration to set an appropriate dry weight. If the body is unable to excrete fluids due to kidney failure, accumulated fluids in the body cause various symptoms such as edema, dyspnea, and elevated blood pressure, which may become risk factors in heart failure. To solve this problem, it is crucial to set and achieve an appropriate dry weight by removing body fluids through dialysis. Now, we will explain 3 indicators of dry weight management. The first indicator is brain natriuretic peptide, BNP. BNP is a protein secreted by the ventricular myocardium in response to stimulation due to fluid volume overload. The standard value of BNP is 150 to 200 picograms per deciliter. If the value is higher than the reference value, it is recommended to reduce the dry weight. If the value is lower, the dry weight should be increased. The second indicator is human atrial natriuretic peptide, HANP. HANP is a protein that is secreted by the atria in response to fluid volume overload. The reference value of HANP is 25 to 100 picograms per deciliter. If the value is high, the dry weight needs to be reduced, and if the value is low, the dry weight should be increased. It is important to note that the high value of HANP may be indicated regardless of the body fluid volume if the patient has atrial fibrillation or valvular disease. The third indicator is the cardiothoracic ratio. Center-center can be calculated based on the ratio of the cardiac diameter, CT, to the thoracic diameter, TD. As fluid volume increases, the heart tissue expands. Therefore, the fluid overload can be detected by diagnostic imaging. When the cardiothoracic ratio becomes high, it is recommended to reduce the dry weight. This is the end of Lesson 6, Body Fluid Management. Make sure you've mastered the basic concepts before you move on to the next level.